Thank you, Mr Speaker. My question is to the Premier. Premier, the COVID case numbers for yesterday were over 1,000 and at least 50,000 Tasmanians have been infected since December the 15th. 40% of Tasmanians over 16 have not had a booster, no child under 12 is fully vaccinated, and vaccine efficacy drops fast. Knowing this, you've started removing mask wearing, the single best simple protection against an airborne virus. The TCCI and Liberal Senator Erica Betts are out pushing to go harder and remove all masks, except in aged care homes. People with disabilities didn't make their short list of those deserving protection. Premier, so many vulnerable Tasmanians have no adequate protection against the risk of infection and disabling long COVID. We need to retain universal mask wearing during rampant COVID transmission.
Right now.
Premier, are you going to cave to industry whims and political interest, or go back to putting the health and safety of Tasmanians first?
Good question.
Honourable Premier.
Yeah.
Table the advice.
You're not even wearing a mask now.
Mr Speaker, I thank the member for Franklin for that question. I'd make the point that I note that the Leader of the Greens, Ms O'Connor, is not asking these questions. I believe that she put herself in such a difficult position after the rampant scaremongering that she engaged in, Mr Speaker.
We're letting our experts ask the question.
I'm an epidemiologist.
Order. One moment.
With responsibility
Sorry,
I would ask this question.
I can't hear. Sorry, your point of order.
Well, it's a point of clarification. The Premier thinks that we've gotten that.
Again, you have your mask on, and I'm sorry.
I have responsibility for the health portfolio.
I'm not completely sure of what you're saying, but the Premier has been on his feet for less than 15 seconds, and so we as a place should allow him to at least answer the question or attempt to answer the question for a little bit longer than 15 seconds before we interrupt him. So, Premier.
Well, thank you, Mr Speaker, but it's a matter that they are very sensitive about because some of the comments from the Leader of the Greens, Mr Speaker, over that period from December 15 onwards, the Christmas period in early January, were simply disgraceful. Were simply disgraceful, Mr Speaker.
Every word I said.
Order.
Lead to a mass disabling event.
Yes.
That's what you think. That's what you think. And that we were engaging in eugenics.
McIntyre says.
And that we were engaging in eugenics. Speaker, it is disgusting and disgraceful, the language that was used, Mr Speaker, and all designed, Mr Speaker, to frighten people. To frighten people, to scare people, Mr Speaker. Now, yesterday I explained that unlike other premiers and First Ministers across the country, I have not dislocated myself from public health. And in fact,
come off.
Miss O'Connor, order.
At every media event, Mr Speaker, where we have discussed changes to our progress in terms of COVID, where we have announced plans, Mr Speaker, where there have been significant changes.
Order in the chamber. Premier has the call.
Mr Speaker, Public Health, Mr Speaker, have stood with me and other ministers, Mr Speaker, and they have explained their reasoning behind the changes that we have taken, Mr Speaker. And so to make the claim that we are being pressured by the tourism sector or the business sector, Mr Speaker, is simply untrue. In terms of the 15th of December and the reopening of our border, Mr Speaker, we slowed the national process. We departed from the national plan, Mr Speaker. Mr Speaker, we saw other states opening at 80%, Mr Speaker. We saw New South Wales removing all restrictions on the 15th of December.
Point of order, Mr Speaker. 45 relevance. Perhaps to people living with disabilities, the Premier could just answer the question about what he's going to do about masks following the pressure from the TCCI.
I don't accept the point of order. There was significant preamble in the question, and it's practice and precedent of this place that along with the preamble, not being too long, but then along with that, I allow, or speakers have allowed, the ministers to some leniency in the length and their approach to answering the question. So there was a long preamble. I will allow the Premier the opportunity to answer that question.
One question.
Mr Speaker, again, and look, I can understand the Leader of the Greens' embarrassment.
I am certainly not.
When I have...
That is so far from
You
how
are
we
just
feel.
completely...
Order.
You can defend yourself however you like,
happy
but
to.
it's quite clear, based on the statements that you made over the Christmas period.
You should go and talk
that,
to parents in school.
You were determined to frighten and scare
Go and
people.
talk to parents.
Point of order, Mr Speaker. On a number of occasions, you've asked the Premier to direct his comments through the chair so he doesn't incite interjection, and he is now inciting interjection.
Sorry, Premier. Whether a minister and who they're looking at when they're making their comments, I would hope that we all have the maturity and respect needed to be able to listen to what the answer is.
Mr Speaker, as I said, I can understand the Leader of the Greens being embarrassed.
I'm not in the slightest.
The
Don't put
extremely
words in her
long
mouth.
list, the
You're the
extremely
one who
long
should be
list
embarrassed.
of frightening and outrageous claims that
Talk to people with
that she made,
disabilities about
the
eugenics.
attack that she on Dr.
modelling.
Veitch through that period as well.
You listened to them then, and now
Just
you're not
outrageous. In terms of masks, Mr Speaker, we have acted on public health advice every step of the way. And in terms of that advice, as I said last week, or said yesterday, and explained very clearly, that on Friday, when we made the announcement regarding masks, the Deputy Director, Dr Scott McEwen, was there with me and took questions around the advice that he had provided, Mr Speaker. And, Mr Speaker, we will again on Friday, as we indicated, we will have another press conference and we will talk about what the next steps may or may not be, Mr Speaker, in terms of mask wearing. And again, Mr Speaker, we will rely on public health advice, Mr Speaker, in terms of the steps that we take. Exactly as we did it, Mr Speaker, at the start of the pandemic when we were one of the first states, in fact we were the first state to close our borders, Mr Speaker, when we were the first state, Mr Speaker, to depart from the national plan, to look for a higher level of vaccination, Mr Speaker, to slow down our reopening, right through this. Right through this, Mr Speaker, we have relied on public health advice and we will continue to do so.